Morning, everybody. Brad Johnson here for Bottom Line Thursday, along with
Chris Poland, sorry. I
Hey,
jumped on.
Chris Byer, we're here. What do we got today,
wonderful.
Brad?
We'll do a quick one, but this
All
was
right.
pretty clever. So, I read all sorts of crazy stuff. So, this was in a journal called Healthcare Economist. Again, it's probably on your reading list, probably at the doctor's office.
Adding it right now.
Yep, wonderful. And their author had a very clever angle to take. And the question was, how will AI change healthcare in 2025? And they could interview a bunch of, experts, but he chose to ask AI what AI felt
Ooh,
would change in 2025.
Ooh,
And so let's see, I'll give you, he went to all the major platforms besides DeepSeek, thankfully.
okay. Yeah.
We don't want that
Yep.
little current trivia there. But this is Perplexity's answer. They talked about AI diagnostic tools will become standard in over 70% of US hospitals. And then it talked about how this Google DeepMind, that I'm not that familiar with, I assume probably will be, is better at detecting breast cancer, and also it says 5% earlier than human radiologists. So I've got to think
Oh, wow.
radiologists are going to implement this because you still need that human eye to say, now that's just,
I've
noise.
always I've always thought radiology will be impacted first, right? Because AI can look at a billion images of just breast cancer and learn
know
what to look
exactly what's
for.
going on. Yeah.
Yeah. Yeah, that'll be fascinating. And then it went into even things like triage, things that all of us on this call don't have to worry so much, maybe more as a patient, but not so much as benefit
Right.
consultant. Talked about chatbots could handle 30% of primary care triage. And then the net effect for
Wow.
patients theoretically is a 20%, or I'm sorry, a 20-minute reduction in waiting times.
Yeah, because I mean, think through all the questions you have to ask, when you come in and sit with a patient initially, get that done by AI, and it's already got it narrowed down to the top three diagnosis. And now you actually see the patient without having to collect data. I mean, that,
Yeah.
I'm
Now I
excited.
will say this. Oh, go ahead.
I'm excited where AI is going to take us because the more wearable data can go
yeah,
into a central hub, now you add your blood draws. I think we're going to learn so much about how to be healthier people. Obviously, we still have to make those changes ourselves, but if that thing says you got 9 years to live if you don't change this, this, and this, that's a lot different than your doctor saying, I really don't like your cholesterol. Here's a statin.
yes,
I'm going to increase it. When it said you have 9 years to live,
yeah, I can
Yeah,
see that
that'd
happening
be
too.
pretty eye-opening.
Yeah.
that'd be pretty eye-opening.
Oh,
Yeah,
great topic. And I'm sure it's changed from the time that we started this conversation. It's
it
probably
has.
better. So,
Yeah. Yeah, we're already being replaced, is what the rest of this article said.
Yeah,
So,
let's not
yeah,
talk about that. We're still very important people.
we are very important. Yes.
EIPs. All right, guys, that's what
I
I've
love it.
got.
Thanks,
Thanks.
Brad.
Thanks for
See
sharing.
ya.
All right, we'll see
Bye.
you.